Intermittent fasting is one of the most used methods in the fitness world that leads to a better result for the health for those who apply this technique. This type of diet is not based on the type of food that should be consumed, but rather on the time in which it should be consumed as if it were an eating pattern. Some consist of maintaining a constant fast of 16 hours a day or 24 hours a day or 24 hours twice a week. Health professionals in the area of human nutrition claim that intermittent fasting can cause severe health problems and contradicting those who claim that it is the best, easy, and quick way to lose weight in a short time. There is no fixed diet or a specific amount of nutrients recommended to perform this technique, in which they assure it is the fastest way to lose weight and burn fat. But it is an itinerary on strict established schedules in order to achieve a complete digestion through so that the organism absorbs all the nutrients of what has been ingested during the past hours. However, it is advisable not to eat foods high in fat, as it would be to throw away a process that restricts feeding for a period of time. It is important to choose foods high in nutrients in terms of the composition of the diet as the body needs, maintaining the rhythm in the same way as if it were in a normal food intake, and not reach anemia due to not knowing how to distribute food well, which, by the way, is one of the low points about the intermittent fasting, since many people do not seek to a nutrition professional for a good advice. The human eating habit of postponed meals results in nutrition or fasting cycles that need good homeostasis. Following a carbohydrate-rich meal, glucose is stored to lower the postprandial glucose level within the sort of glycogen and later in fatty acids. In the post-absorptive state, after eating, the processes are reversed. To understand the processes that occur within the feeding fasting cycles, you want to first have to have a previous vision of how the organs participate in metabolism.
As a student, we were able to realize that intermittent fasting can negatively and positively affect the human being depending on their physical conditions, since it's not recommended for patients who, who have active gastric ulcers, are pregnant, or breastfeeding. That is why we must analyze what the change, whether positive or negative, during the practice of intermittent fasting. Our project is based on nutritionally evaluation a person who begin to perform these techniques for 3 weeks to analyze their change and other aspects, concluding how intermittent fasting affects their metabolism.
A search was carried out for a situation in which controlling scenarios were experimented between 2013 and 2017, which studied a group of people who were subjected to an intermittent fasting diet, and a random group, other which a daily calorie limit diet. In the 2017, in a clinical trial carried out in a group of 69 obese people for a year, and the study revealed that the fasting on random days produced weight loss of 6.8% after 6 months of test, which that does not reveal a difference in their masses. In another study involving 26 obese adults with a duration of 8 weeks, the level of safety and change in the body weight and the insulin index of the people in the study were studied. In the first group was completely calorie restricted, while the other group was on a diet capped at 400 kilocalories per day. However, the first group lost total fat mass by 0.8 and they gain less mass by 1.2 kg. The second group gained fat mass by 1.2 kilograms and lean mass by 1.1 kilograms in this study.
The scientific evidence based in the race presents certain problems, since the variations between the nutritional parameters, times of the restricted periods, moments, and the same place and the humans studied. The reduced sample and the lack of the control group are some of the parameters that could contribute to the complexity of the result obtained. Brain translates to weight loss in the people and animals, but the caloric adjustment and the nutritional training indicate having similar results based in the discrete in the body mass. Being the recommended was the long terms when lost. The range indicate as an alternative of the difficult present to the maintain in the hypercaloric diet. The studies in humans did not indicate adherence to the regimen, concluding in difficulty in taking this diet for the long time. The concern that occurs of the adipose tissue and the hypothyroidism are demonstrated in the animals model, as well as the food compulsions, compensations of the caloric computing in the days of the living to feeding, the consequent recovery of body and the increment stress. They working indications of the strategy for the humans for the purpose of weight loss, especially due to the limit reached and its long-term effects in the CNS. Thank you.